Hi everyone, Larry Wynn at Summit Imaging, an ultrasound and mammography equipment support organization, and we have our special guest.
I'm Carolyn Coffin. I'm an ergonomics consultant with Sound Ergonomics, and I'm also a sonography professor.
Carolyn helps us a lot here at Summit. If you watch some of our videos, she is a common guest here, and she's been really important to making us better as an organization for image quality and making sure that we're taking care of our healthcare facility customers and the patients that they care for by giving them the best quality repaired equipment that we can. And so today we're going to talk about, in particular, a massive drop. And this drop is actually fairly common for a particular transducer. And this is actually a mechanical or a volumetric transducer, which is the transducers that have domes. And those domes then have a crystal inside, and they physically sweep back and forth, and it compiles a 3D or 4D image for the patient. And but this is a common failure. So let's talk about the issues here first before we kind of dive into the mechanics.
Well, from a clinical standpoint, there's a huge issue here. Let's assume that we're scanning a liver, and we have this area of dropout here, which presumably the sonographer would notice that there was something right at the near field that was contributing to this. But if they didn't see that, or if it wasn't visible on a real image, this area of dropout is hiding a lot of information. There could be a lesion, there could be a cyst, there could be some kind of a vascular issue in the liver, and you've lost that information. Any loss of information makes it non-diagnostic, but the sonographers often, and the physicians interpreting, often don't appreciate what the transducer problems are and what they can do to degrade the quality of the image. So you definitely want to have a nice homogeneous image across there, and definitely don't want any areas of dropout or areas that are being hidden by this shadowing.
Yeah. So what we're seeing here in this volumetric probe, because they're mechanical and sound doesn't travel through air very well to create an image, and so they're filled with oil. And what you're seeing here, this is actually an air bubble between the lens and the crystal, because there should be oil in between that. So oil is leaked out some way, somehow. Maybe it was accidentally banged when somebody was rotating to put a probe away back onto the ultrasound machine. Could have been dropped. There's a million ways that you can damage a probe, but what we're seeing is a result of some sort of impact that has compromised the seal of oil inside of what we call the top dome of the lens of the transducer, and it is now being displaced with air. And that air is what you're seeing here. So when you actually rock a probe back and forth, you'll actually see this air bubble move across the crystal.
So there's some troubleshooting a sonographer could do if they knew to give that a try.
Yeah, absolutely. My assumption is that because of the amount of missing data, that would probably be a probe that nobody would even want to use.
Right,
at that
you're right.
point. This has to come in for repair, and we're able to actually go in and not only take out all the old oil, but put in the new oil and replace it all and restore the whole image and replace all the seals and get those correct again for
Well,
the
I
customer.
know as a sonographer, I don't always think of the transducer as the problem. Sometimes I think of the heart of the software in the system.
Maybe that has a little bit of gel right there, and
Or
I need to
something.
move. Yeah.
Or there's a software issue. But one of the things that I do know has happened, and this is with older transducers, I don't know if this is still happening today, but I worked in Colorado, so I worked at altitude. And transducers that would come in new that had oil in them often would create bubbles because of the altitude change.
Got it. Yep.
So there's, knowing where you work and how that affects what your equipment does is important too.
Got it. No, I didn't even think about that at
Yeah.
altitude. That makes a lot of sense, and
If
we
they're
all
made-
learn something every day. As we
If they're
talk to each
made at
other.
sea level and then shipped a mile high, it has an impact.
Got it. And so it'd be interesting to look at the data to see if the higher altitude facilities are actually seeing some more bubbles and whatnot. But from what we see, for the most part, that there is definitely some sort of impact that had occurred to compromise the seals, and then actually the oil leaves the cavity that's supposed to stay in, and then is replaced by air. And then this one, this is a catastrophic issue for image quality, but a very common issue for mechanical volumetric transducers.
And it's time consuming for the sonographer
Oh,
to troubleshoot it, to
And it's messy too.
Yeah.
Yeah. We've got probes come in where there's oil all over the box and all
Yeah.
that. It's a messy proposition. Takes a long time to clean up and make sure it's right. But
And it impacts the quality of the exam.
Yep. So I hope the audience learned a lot today. Thank you, Carolyn, for coming again. And please like us on Facebook, follow us on LinkedIn, subscribe to our YouTube channel. And again, we got more videos coming to educate the healthcare community on what's going on with your equipment. And until next time, thanks for watching.